Hello and welcome to Fit Professionals. My name is Michael Coleman. This video is part 2 in our 2-part series on chiropractic without cracking. One of the first things I learned when studying to become a corrective exercise specialist and personal trainer was the importance of having a very strong referral network. Of course, no one knows everything. That's why it's part of my duty to refer my clients to other therapies and other doctors who can help them in areas outside of my scope of practice. Like Dr. Alexander Young, a cutting-edge chiropractor who uses a technique called torque release. We continue in this video with more information and practical guidelines you can use today. But one of my questions is about this three-legged stool concept that you have. Can you tell me a little bit more about that?
Yeah, so we say that there's three important keys to your health. So the first and most important is going to be those corrective adjustments in rhythm. So following the doctor's recommendations, getting adjusted in a rhythm or in a frequent manner, depending on what that looks like for that specific person. The other two legs to that stool are going to be breaking bad habits and corrective exercises.
Okay.
So those exercises are going to help strengthen things, help build us in the correct direction. Breaking bad habits, if you go back home every day and you're eating Cheetos, slouching on the couch for 12 hours a day, it's not going to help us move in the right direction, right? So we want to start to break some of those bad habits and make sure that we're doing everything we can to push you in the right direction.
Okay. As a corrective exercise specialist, I would like to know more about these exercises that you're talking about. Obviously, I know from my work with you that you gave me some really great suggestions and things that I can do at home or at the gym, and I actually followed them. I would like to encourage people to follow more of these things. So can you give me an idea of some common things or exercises that you've found are useful?
So the most common thing that we find, especially when it comes to the neck or the upper back, is that most people start to kind of slouch forward. That head starts to come forward. Part of it is that a lot of us sit at a desk all the day. We're looking down at computers, phones, books, whatever it may be. We spend a lot of our life looking down. So we want to make sure that you're standing up straight, keeping that head back. An exercise that we recommend all the time is chin tucks. Just kind of bring that head back, giving yourself a double, triple chin, holding it for a few seconds and relaxing.
Okay, the next area was thoracic spine. What do you see with that a lot?
Yeah, so thoracic spine, again, is going to be somewhat similar to the cervical spine. It starts with our posture. So again, we start to see that head come forward, but we start to see the shoulders come forward too. We start to see the shoulders round. We start to get into what we call a nursing home posture, right? Walking around the nursing home, slouched over.
Yeah.
Obviously, no one wants to get there. So an exercise that we recommend commonly is what we call scapular retractions, putting the elbows at 90 degrees. If you have an exercise band, you can do it with an exercise band. Just bringing the hands outward, and you'll feel the strengthening in the back, in the scapular region or the shoulder blade region.
Thank you very much. The thoracic spine has 12, so so how about towards the bottom of the thoracic spine? What kind of things would you suggest for that?
So as we start to get into the lower thoracics, we start thinking about the core. Again, staying with the routine of posture there. As we start to get that forward posture, our muscles in that mid to low back, or that transition zone in the lower thoracics, upper lumbars, will start to weaken. Those muscles don't work as well as they should, and we start to slouch even more. So an exercise that we recommend commonly is bird dogs. It's going to help activate the muscles in the back. It's going to help activate the core and really help somebody stand up straight and gain that strength to be able to stand up straight.
But thank you very much. Yeah, I've seen that exercise before, and I think it's been helpful for most people. So it's cool to know that it connects with what you guys are doing.
Absolutely.
Okay, so finally I'd like to get into the lower back and talk a little bit about deep areas that a lot of people have trouble with. Can you just give me an idea of some of the exercises that might relate to that?
Yeah, so when we're looking at the low back, the first thing that I always like to talk about is the exercises that we shouldn't do. A really common exercise that a lot of people love is sit-ups, right? They're easy to do at home, but the sit-ups actually put a lot of pressure on the low back, specifically in the area of L4, L5, S1, and that's usually the area that we first start to see kind of break down in the low back. Research shows that it actually puts 3,000 newtons of pressure, or about 700 pounds of pressure, onto the low back. So a lot of extra weight causing that area to start to break down faster than it should. Instead, I recommend replacing it with a camel exercise or with planks. We can do front planks, we can do side planks, making sure that we keep those hips and that low back nice and even. We don't want to see one side of the glutes start to sag down or one side of the low back start to sag down. And really focusing on these exercises, doing these exercises properly. It's not always about the weight that we're doing them with. We want to make sure that we are getting these simple exercises down first, and that will help make everything else more effective.
So I had a quick question. One of the things that I've learned to focus on is stability in the core, especially, but that when we do rotation, that most of the rotation comes through especially in the area, would come through the hips, and that the spine is not overtaxed with trying to, the hips being just stuck and then the spine going to the side. Basically, do you agree with that?
Yeah, so when we're looking at the low back and the hips, a large part of the rotation does happen in the hips. We will see a little bit of rotation in the lumbar spine to help accommodate to that and help you rotate, but a large majority of it does happen in the pelvis. So if the hips aren't moving properly, we will start to see everything else break down with it.
Okay, I really appreciate it. Thank you so much.
Absolutely.
Learn how to train pain-free. Get the most effective pro tips delivered to your inbox each week by subscribing today to our free newsletter at fitprofessionals.beehiiv, BEEHIIV.com.